Good morning and welcome to another edition of CCH Checkup brought to you by Carroll Community Hospital. Today we are talking about bone density exams, and joining us we have Melinda Deming. Melinda is an x-ray tech at Carroll Community Hospital. Thank you for joining us today, Melinda.
Thank you for having me.
Let's start right off. What is a bone density exam?
A bone density exam is used to measure bone strength and its ability to bear weight. It's used to diagnose osteoporosis and osteopenia.
And what is osteoporosis?
Osteoporosis is a disease characterized by a decrease in bone mass and density occurring especially in postmenopausal women, resulting in a predisposition for fractures. Actually, May is National Osteoporosis Awareness Month.
And what is osteopenia?
Osteopenia is a generalized reduction in a bone mass that is less severe than osteoporosis, sometimes referred to as pre-osteoporosis.
And what are some things that can reduce bone density?
Age, certain medications, and a poor diet with increased salt and lack of calcium. You should always check with your doctor if you have any questions about whether or not you should have a bone density test.
And who is the ideal person who should have a bone density exam?
Postmenopausal women, anyone over the age of 65, anyone taking long-term medications that may reduce bone mass, and anyone with an illness that may reduce bone mass.
And how often should a bone density exam be done?
It's usually recommended every 2 years unless there's been a change in medical history or medication that may affect your bone mass. It's always best to check with your insurance company to see how often a bone density test is covered.
And what can be done to increase bone density?
Regular weight-bearing exercise, eating foods that contain calcium or taking calcium supplements, milk, yogurt, cheese, and soy are good choices. Taking vitamin D. Vitamin D helps your body properly absorb the calcium from food.
And how does a person prepare for a bone density exam?
You have to make sure you've not had any tests containing barium or iodine for 7 days before the test. Contrast agents will interfere with an accurate bone density reading. You should also wear comfortable clothing. Elastic waisted pants are the best, and always bring a list of your medications with you.
Alrighty, well, we want to thank Melinda from Carroll Community Hospital for getting us up to speed on bone density exams. Thank you for joining us today, Melinda.
Thank you.
And as always, you can check out cch-mi.org for more information, and tune in next week for your next edition of CCH Checkup, brought to you by Carroll Community Hospital.